So before the coffee break, we have the European Canadians. Derek and Attila, please.
Thank you. Have a good day.
Thank you so much, Jan. And first of all, I would like to say a big thank you for inviting us. After all, we share two borders, at least that I know of. Saint-Pierre and Miquelon is a small island south of Newfoundland. And you may remember the Hans Island whiskey dispute border with Denmark, right? So practically Europeans. So before we get going, I just want to mention that the presentation will be distributed. So we're going to go very fast through it. There's a ton of content we thought it would be important for you to know. And then we would be more than happy to answer any questions in breaks and in the further days to come, because we're here all week, okay? So by way of introducing myself, Attila Farkas, Senior Director with Canada Health Infoway, and our colleague and friend Derek Ritz. He is our Canadian liaison to IHE International. He's going to walk you over our collaboration at the international standards, and then I'm going to walk you through the international patient summary work that Canada has been doing lately, okay? So Derek?
Sadly, this seems to be a little bit, oh, there we go. I was going to say it was child-proof, and I wasn't able to make it go. There we go. All right, so as Attila mentioned, I'm going to go through Canada's involvement in the international work. It's a team sport, the work around the IPS, the International Patient Summary. And then he is going to walk through what has been some of our domestic experience, and we'll see if we have time for Q&A. We will talk about what then follows, what we're going to do in the future. As Attila mentioned, I mean, these are not intended to be eye charts. Some of these are quite detailed slides. We are instead just going to use these slides to drive our narrative as we go through telling this story. Now is probably also a good time to go through the mandatory apologies. We are Canadian, so it goes without saying that we have to make a few of those. We are sorry that we're going to have to go through so quickly. We also abjectly apologize about the fact that I'm going to talk a little bit about Canada's involvement in some of this work, and we're very proud of that, but we're not very good at blowing our own horn. So I'll apologize that we're going to do a little bit of blowing our own horn, and I'll apologize that we apologize so much. This is our storyline at a top level, and these are some of the people that are participating in this story. I'm going to start talking about the international work. Firstly, there's been quite a significant amount of effort put into this through the Joint Initiative Council. The JIC has been around since 2007. You can see along the bottom that the usual suspects in terms of digital health standards work are participants. You can also see that there's been recent collaboration with the ITU and with WHO. And this happened sort of at the tag end of GS1's chairmanship of the Joint Initiative Council. I do want to call out that Mike Nussbaum, who is the IHE representative to the JIC, under his chairmanship, some work was begun as well around IPS, and that was quite an important contribution. Elizabeth Keller, our head of delegation, Don Newsham, our head of delegation emeritus, all had quite a hand to play in how IPS was getting launched as a JIC work item. As honorary Europeans, I will also say with great pride that it was CEN that got the ball rolling. The IPS began as a pan-European specification. So IPS has become a focus of the work of JIC. Both Attila and I presented at an open forum that was hosted in December of last year. There's also a very excellent website that contains information, and including some short videos that I prepared on behalf of HIMSS that give an overview of some of the IPS work. And as we said, we're going to be sharing this afterwards, but the internationalpatientsummary.net with hyphens is where you can find this very excellent content. We're at an IHE conference. I think it's important to note, again, our own fellow Canadian Mike Nussbaum co-chaired the development of an IPS profile. Why is that important? Well, in fact, this profile described very explicitly in a normative appendix how would one conformance test a solution that purported to be adherent to the International Patient Summary specification. And that's where IHE adds a lot of value. Canada is a participant in the Global Digital Health Partnership, and in fact, Attila and a colleague of ours, Andrea McLean, often attend these calls. The GDHP has 33 country members, plus the International Digital Health and AI Research Collaborative, the OECD, and WHO as non-government participants. There are 5 work streams, and Canada chairs or co-chairs 3 of those 5, including co-chairing the interoperability work stream, where IPS has been a focus item. Canada is a member of the G7, and the G7 undertook that standardized minimum health data set for patient information would be of a particular focus for G7 countries, and they doubled down on using the GDHP as the way to progress that work because they already had it in their portfolio to do. WHO is a member of GDHP, as I said, and I actually spent a year working with WHO's core team, the digital health core team, around the COVID certificate program. The COVID certificate program calls out IPS as a foundational element, and in fact, for the first time, WHO published implementation guides, published implementable specifications. Those specifications, in addition, call out 4 other IHE profiles, and our own IHE Catalyst team was helping test, conformance test solutions in South America, I think they were, and their adherence to these specifications, these COVID certificate specs. All right, the key takeaways. This is a team sport. Canada has been participating in work alongside others, shoulder to shoulder with teammates, in progressing the international patient summary effort. We're proud that we've participated as an agency. Canada Health Infoway is our representative agency to GDHP, and we've been participating as community members. And I'm going as fast as I can to try to make up time, and I'll hand over to Attila. The green one makes it go the other way.
Thank you. I'm going to press the red then. Okay. So let's see. There you go. So recognizing that interoperability is not a technical problem, it's literally a change management and people policy problem. We started with the IPS work in Canada by authoring a white paper at the highest level, at digital health level in Canada, and we tried to get the National Leaders Forum to read this, to buy into it, to understand what is the value, what is the business proposition of an international patient summary document. So we started with that, and right after that, do I need to aim this at something?
I told you it's childproof.
Okay. There you go. Perfect. So as Derek mentioned, our company, Canada Health Info, is a not-for-profit funded by the federal government, but we are also the host organization for all the SDO engagement across the international boundaries. So we have HL7 International, IHE, ISO. We are at LOINC and SNOMED CT, as well as GDHP more recently. And it is our standards team that collaborates and pulls it all together so that it can support national digital specification development. It was almost a no-brainer that we had to start working towards the International Patient Summary, because even as early as 2019, when we were doing surveys of primary care physicians and their access to patient information, we were fairly lagging in the developed world. And so we decided that we're going to accelerate this thing a little bit, and we put a marked focus on this. What happened is we started by putting together a proper governance. As some of you potentially know, Canada is a federation of provinces and territories, 13 of them, similar to Switzerland. So we decided that we're going to try to bring as many as we can to the table and organize the governance structure where we had both the day-to-day covered, but also the executives, so that they understand that if this gets developed, they will have some obligations to adopt it as part of their policy. The patient summary in Canada, obviously, it is based on the international specification, both ISO, HL7, and IHE. We try to cover all of them. Recognizing that this has to be approached, recognizing that it's a dual aspect to it. Both the data and the transport needs to be covered. So we call it the level 2 specification. And by doing that, we wanted to make sure that it's understood that this is going to take a while to adopt. So we're going to go from top to bottom, start with local exchange of patient summaries, and then we're going to grow towards international. So we started by identifying 3 use cases that are the most clear use cases: creation of a patient summary, submission of a patient summary, query, and consumption of it. And then using these, we developed a specification that ended up being a 4-volume specification to our core. One is basically describing the interactions between actors. We adopted the IHE methodology to progress this. And we also decided to do some work on the data model. Our IPS specification is based on FHIR fully. And what you see in this picture is basically how much of the IPS we decided to do in first release and how much is relegated to future releases. In parallel with that, and this is the actor diagram that basically maps the use cases to the actors, we also developed a reference architecture because we wanted to make sure that we're going to promote the idea that you have standardized services in the ecosystem that are going to act as certain actors, and then you don't need to prescribe to jurisdictions what they should do. They can literally pick the actors that are appropriate for them and use it that way. We subjected this thing to a 3-phase review last winter, and by the time we hit March, we managed to convince a couple of vendors to come and try out the specification. We only had a month to get everybody together. So considering that, kudos to our friends from Caraval who helped us put together a projectathon in a record time, and we managed to get 5 vendors, and you can see some of the vendors being international vendors that participated and exchanged the first set of patient summaries for the Canadian specification. There's a little bit of statistical information here about participation, number of tests, and so on. It was a really small event, only 2 days. I think to pull it together, I just want to reiterate that we know that this is a socio-technical problem to solve. It's not just a technology issue. It's not just a standards issue. But so far, we had been fortunate and very happy to work with the international organizations that support these efforts. And with that, I think I'll hand it over to you and close us up.
One of the other things I think is worth noting, bullet 2, I know that there was commentary earlier about getting quick wins, and that is important. You have to be able to build momentum. I think it's also very important to choose something that matters. If you have a quick win on something that doesn't matter, I don't know that that builds as much momentum. And I think that the choice of the use cases spoke to the heart of what it is that we're trying to address as a problem. And I think that that fact helped us get attention and helped us get interest and buy-in from some of our jurisdictional partners. I also want to underscore, in theory, theory and practice are the same. In practice, theory and practice are not the same. And I think that projectathons do a wonderful job of moving us from theory to practice. And that's a very important thing. And we held our first one earlier this year, and I think it was a watershed moment for Canada. Right. Okay, well, what's next? We have an expectation as an early adopter of IPS that we're going to be feeding back to the standards organizations. We also have an expectation that we're going to be feeding back to IHE Catalyst and what are some of the things that need to be important parts of the tools. So key takeaways regarding our lessons and next steps, and I apologize, we don't have a screen at the front, so I'm going to turn my head away from you. We're going to continue to engage with the international partners, with the folks that we're working with. And I actually participate in a cross-SDO session every 2 weeks that is managing how the various standards organizations are going to continue to progress the international patient summary specifications. We want to participate in the evolution of the tools needed to be able to test this. The IPS is going to play a crucial role for us in Canada, and I don't think we're the only ones, not by a long shot. All of our jurisdictional partners are at different stages, and we have to engage with them where they are, and that's why the maturity model was such an important piece. And that lesson is pointing us in the direction that we have to go. We have to be able to move them from success to success. We do expect that the projectathons can be an instrument of innovation. So we have this sandbox aspect to it, and we want to be able to leverage that. We want to be able to, a rising tide lifts all ships. We do want our vendor community to be able to leverage the Projectathon events to their benefit. But we also want to put these tools in the hands of our jurisdictional partners as instruments of governance. We do have an expectation that after some period of time, solutions in Canada will be plug and play, and they will be able to execute the transactions they purport to be able to execute. We have some work items that are underway that Canada Health Infoway is leading, related to a permanent governance table, related to a pan-Canadian health data model, and related to the operationalization of a national gazelle instance. And there it is. And I'm sorry we went a little bit over. Very sorry.